So this was actually a patient we saw a few weeks ago in Europe. So a 60-year-old woman, nice woman, retired, and her history was of left shoulder pain, but that wasn't her primary complaint. She was brought in by one of the therapists on the course who said, she just can't move her arm. And I'm thinking, okay, that's great. This was a CDM course over there, so we're happy to see any type of patient, not that we wouldn't on any other course. But her primary, when we asked her limitations, she said, I can't raise my arm. I have trouble doing my hair. And I like to swim for exercise, and I haven't been able to do that for quite some time. So we get into the history. She had actually had the problem for 3 years and status unchanging. And her story was that 3 years ago she was swimming, nothing out of the ordinary. And after she got out of the pool, she noticed that she was having some discomfort in the shoulder and a little bit of pain down the arm, not too far, just a slight little bit of radiation. And she didn't think much of it. And she said the next day she woke up and the pain was more severe. So she kind of kept her shoulder a little bit still, and I think she took some anti-inflammatories, something like that. In a fairly short order, the pain resolved. But as the pain resolved, she noticed that she couldn't lift her arm. And when asking her, why can't you lift your arm? Was it painful or stiff? And she said, no, I just couldn't lift it. I'm like, okay, all right. I've heard that from people before, but you're thinking 3 years. Unchanging, minimal symptoms. Well, has she essentially got an articular dysfunction or a frozen shoulder, and she just doesn't, if you don't move it to the limit, it's not really going to hurt, but you're not going to be able to move her arm. Interestingly, she had had a upper thoracic compression fracture, which is a pretty unusual creature, 10 years earlier, and I didn't quite get, was it due to a trauma or disease, and she was kind of vague on it, but she had a very, very pronounced upper thoracic kyphosis with a very forward head position. So in talking to her about better or worse, again, she didn't really indicate much because her complaint was not really pain. It was the inability to raise the arm. So when you
Month after month, new guest experts sharing actual patient cases and subscribers sharing their own challenging and interesting cases. Check out Case Conversations at mechanicalcareforum.com.